Well, this morning we begin with a doctor who holds the key to Colorado's own fountain of youth. It's not something that you're actually going to find in a bottle, a syringe, or a secret potion. The magic starts with a physician who has focused his entire practice on rejuvenation on two areas of the body, the face and the neck. The Center for Aesthetic Facial Surgery was founded by Dr. Michael Minenkoff, the recipient of America's Top Physicians Award for Facial Plastic Surgery for the years 2003 through 2009. He's been featured in United Airlines Concierge magazine as one of their best of the best and was recently named as one of the top doctors in the global directory of Who's Who for 2009. Obviously, this doctor knows exactly what he's doing, and I'm glad that Dr. Michael Minenkoff decided to join me. How are you?
I'm good, thank you.
You know, in the introduction, one thing caught my attention. You feel it's very important because you focus just on the face and on the neck. Why is that important?
You know, Denise, 90% of the cosmetic surgery done in the United States today is breast augmentation and body liposuction. Mm-hmm. So typical, very good general plastic surgeons, 90% of their time is directed towards those areas, and the last 10% then for everything else. I'm a facial plastic surgeon. I'm in the head and neck. It's the only place that I go, and that's where I am 100% of the time.
Thank God. If I trust my face into a doctor, I want to know that he focuses on that one. You know, it's like an art to you. You also have been a doctor here for 17 years in Colorado. That's also important for the people watching today.
You know, it really is. Colorado is different than other places in the country. You can go to Beverly Hills, you can go to Fifth Avenue in New York for facial plastic surgery, but facial plastic surgery there is very, very different. It's a very stylized look. In my eyes, almost kind of an Art Deco kind of experience where it has a very characteristic appearance which really doesn't look natural, healthy, or really normal. Our brains are very in tune to when things don't look quite right, and they pick up on it easily. And I'll have people come into my office that have had surgery in some of those places. I can tell when I see them where they had surgery, and sometimes I can even figure out which surgeon did it because there's a particular trademark.
Is that trademark? You're talking about like the big lips? I mean, they look good on Angelina Jolie. They don't look good on all of us.
No, they really don't. Yeah. And, you know, in Colorado, what people are really looking for is to look very healthy, very natural, and have it look very normal. They don't want it to look done. They don't want it to look operated on. I tell most of my patients, look, if after you've had your surgery, you go see your friends and family, if the first thing they ask you is, who is your surgeon, then I failed. That doesn't work. And in reality, what happens most of the time is that they'll have people will look at them. They know they look great. They're not really sure why, and so they'll figure, oh, is it your hair? Did you lose some weight? When in reality, they actually had some surgery.
You're getting plenty of rest. You also care about their time because not a lot of people can schedule time off of work and then come back 3 weeks later because they had a procedure done.
Right. Yeah. I don't have many patients that have trust funds and can sit around their house for 2 months waiting to get better.
Yeah.
My patients, they work hard, they put their money aside, they've saved for this, and they want to do something. But really, there's three things that most of my patients are looking for. Number one, what we already mentioned, is that it's a natural, normal, non-operated on, healthy look. Mm-hmm. Secondly, is that they work, so they can take a week off from work, maybe a couple extra days over that, but that's it. So it really has to be something that they can be back to work around 7 days, looking good enough that people don't realize that they'd had surgery a week before. And I've really designed and picked most of my procedures in that way, and that most people 5 to 7, 8, 9 days sometimes are back doing their normal stuff, looking good, and not having people knowing that they had anything done. And then the third thing is that since they do work and they put this money aside, it has to be something that's going to last for a long time. They're not the kind of people that every other year they're going to be back in my office doing something else. It has to be something that's going to last them for a very long time.
It sounds like you're very considerate of your patients' needs. That's a good thing. Now let's take a look at some of your work. We have some before and after pictures. Walk us through, please.
You bet. Well, this is an example. This is a gal that came in concerned about the heaviness to the lower part of her face. Had some jowls, the nasolabial folds, which are the lines from the corner of the nose down to the mouth, and the neck was sagging a bit, and really just wanted a more youthful look. She had what we call a quick lift, which is my version of a mini facelift. It lifts the neck, it takes care of the jowls, takes care of the heaviness at the bottom part of the face, and adds a little fullness back up to the cheeks.
She does look so much younger and happier.
It really did.
Yeah.
And, you know, she said that when she came in, that people would think she was angry or upset, that she just didn't look rested or real healthy, and she felt like she looked older than she really felt. And so you can see the kind of results that you can get with that.
Very natural.
Very natural.
You can tell that wasn't done in Hollywood.
Like
that was very natural.
Still definitely her.
Tell me about this one.
Same idea. You can see she's got the jowls there along the jawline, some sagging in her neck, and really just felt that she looked old. This gal is in her late 60s, close to 70 to begin with, so really looked pretty good to begin with, but wanted something that would just freshen her up, that would make her really look young for her age. And that's the other thing that we're always after with this, is that if we take someone who's 70 and try and make them look 20, it's just going to look odd. And what we're really trying to do is to make her look like a really, really young 70-year-old. Yeah. Maybe people guess she's 60, 65, something like that, but still within the same age range. Still looks like her. No one guessed afterwards that she'd had anything done.
No.
People knew that she looked great, but couldn't really put their finger on what had happened.
Doctor, her neck looks fabulous. I mean, really, really natural. And I have been like doing the A-E-I-O-U, all those, stretches and trying to build those muscles. It doesn't really work.
Right. Well, you see a lot of infomercials for that on TV as well. If you think about it, we're moving our neck muscles, facial muscles hundreds of times every day. And it's something that we don't need any extra effort doing. We do it enough. So more exercise isn't going to help. The problem is the muscles are in the wrong place. They've sagged. They've come down a little bit, and it's not a tone issue.
Do something about it and do it naturally so you look absolutely gorgeous. This doctor can do it for you. Consultation. If I came to your office today, what would it be like?
Yeah, we try and make it as comfortable an experience as possible. You'll first sit down with our patient care coordinator who will kind of talk to you, see what it is you're really looking for. I'll come in and actually spend a fair amount of time in the room really trying to find out what it is that really bothers you, because that's really the underlying issue. Sometimes people will come in and say, well, okay, here's my face, what should I do? And the real answer is, what bothers you? When you look in the mirror, what is it that you see that you'd like to be better? So we really try and get at that. We then do computer imaging. We'll take your picture, put it on the computer, and we can make changes then on the computer, giving you an idea of what it'll look like afterwards.
That's great.
Which is, it's helpful in a lot of ways. Number one, make sure that it's really something that we can do that you want. Occasionally someone tells me what they want. I think I know what it is. We put it on the computer, we show them, and they say, no, I want it to be more than that. When in reality, maybe we can't do more than that, in which case we know, okay, this really isn't the right thing for you. Other times they're not sure if it's really the right thing for them. They see it on the computer and they can say, oh yeah, if that's what it's going to look like, I know I'm going to be happy, in which case we know it's going to work well.
Boy, you really are a great doctor that cares about their patients. Let's look more from before and after photos. You brought another one here.
Right. This is a gal that came in. You can see on the before pictures she's got very heavy to the bottom part of her face. She's got a lot of sagging and fullness in her neck. And she actually had a fairly weak chin. So in her we did the quick lift, which is a procedure that takes about 2 hours to do. Typical facelift, 4 to 8 hours for surgery. Quick lift takes 2 hours to do, look really good at a week with some makeup, back to work very quickly. And again, you can see this is a very natural, normal, healthy appearance. It doesn't look like she's had surgery. It doesn't look done, but it really gave nice symmetry and harmony to her face. Here's another example. Same thing. She came in. She felt she looked old. She looked tired. Heaviness to the bottom part of her face. She had a quick lift. We also did some eyelid surgery as well. This picture, I believe, was taken at 2 weeks. So you can see at a week she actually, with makeup, looked good. Here she is at 2 weeks. Really made a very nice difference.
She does. Yeah, her eyes are much brighter. Beautiful work. Thank you very much for coming on the show.
Thank you very much for having me.
Nice meeting you. Yeah. And here's a little tidbit. Before you get the chin done here with this doctor, as you're taking pictures, just push out your neck a little bit. That takes care of it. Does it not? It does. See? There you go, girls. The advances in facial plastic surgery eliminates the lengthy downtime and gives you that natural look. You only better. Call the Center for Aesthetic Facial Surgery to schedule your complimentary consultation and free photo imaging. Their number again, 303-792-3838. Be sure to mention Colorado and Company when you call for a 10% discount on all cosmetic surgery procedures that are booked in the month of October. Plus, if you call today, you're going to receive 50% off all spa procedures as well. Okay, the number, again, you're going to want it, 303-792-3838. And you can learn much more about Dr. Michael Minenkoff online at thefaceexperts.com, thefaceexperts.com. And the Center for Aesthetic Facial Surgery paid for this segment.